For most of us, improvement is a driving force in our lives and in our work. And most of us want to get better at the things we do. Businesses and, in fact, whole industries are no different. And with a quick sweep of the headlines around Alberta's election, you would quickly realize that healthcare is one of the top priorities for Albertans, and improving the system is critical to support our ever-growing population. Well, welcome to a special series of The Brief called Advancing Missions and Moonshots. I'm your host, Brittany Brander, and in this series, I talk to leading experts, business leaders, and innovators and thought leaders across Alberta and Canada to explore solutions to the world's biggest challenges in energy, agriculture, and health. And in many cases, Alberta's healthcare would rank among the highest in the world. But in our pursuit to improve outcomes, we may have forgotten a few critical pieces along the way. And so today I am joined by esteemed entrepreneur and business leader, Dr. Breanne Everett, co-founder and CEO of Orpyx Medical Technologies, a leading digital therapeutics company here in Alberta, to discuss what healthcare could look like in Alberta and a few strategies to build a system that supports the health, wellness, and longevity for all. Welcome to the show, Dr. Everett.
Thank you. Thank you very much for having me.
So before we get into the meat of our conversation here, can you just tell our listeners a little bit more about you, about your company, and how you came to found your company?
Absolutely. So my background before going into the entrepreneurial side of things with Orpyx was clinical. I had done my MD at the University of Calgary and then started my residency training in plastic and reconstructive surgery. And in the course of that training, saw people every single day who were losing their legs to diabetes, and realized that we did not have good preventative approaches to this problem. And we've been taking an approach that really prioritizes addressing that in an acute way once it's really too late to get ahead of it. And the problem at the end of the day is that most people with diabetes lose feeling in their feet. And if you can't feel the part of your body that's seeing most of the force and trauma throughout the day, then you're really prone to developing wounds without even perceiving the pain that would otherwise stop you from doing that. Mm-hmm. So the concept for Orpyx as a company was to create sensory insoles that would do that for the individual. Mm-hmm. And it would allow for customized advice on activity and movement to stop people from getting into those states in the first place, and ultimately stop wounds and amputation from happening. So there was a group of co-founders and myself that at the time got together. We ended up starting Orpyx, and from there, I ran the company for an early period of time while doing my surgical residency, and then realized that it was very unfeasible to be running a high-growth tech startup at the same time as doing a surgical residency. So I decided to take some time away and actually do an MBA. So I did that through the Haskayne School of Business. And then from 2013 onwards have been exclusively focused on Orpyx and growing that company within Alberta.
Does the name Orpyx come from orthopedic?
That's a great question. So, one way to think about the name is Orpyx, like pictures of orthotics or pictures taken by orthotics, but that's actually not the genesis of the name. The name actually comes from an anagram of the word proxy, and it's because we are taking in sensory data in a different way and providing that back to the individual for preventative applications. So it's an anagram of proxy.
Oh, well, that's awesome. So in this piece that you wrote for BCA, for our Missions and Moonshots series, you illustrate this very stark contrast, and I alluded to it in my intro, in Alberta's healthcare system, where in many cases, our system is probably among the best in the world, especially if you experience a traumatic event. But in our pursuit to improve, there's just some pieces that aren't quite in place and some gaps that we've left. Can you explain that contrast just a little bit more?
Yeah, and I would say that this problem is not unique to Alberta. I think we've got a great opportunity to do the best in world job of addressing it. But I think just necessarily out of how health systems have evolved, they've evolved to a place where we are addressing things in a more reactive way. So we're addressing those most acute triaged issues that require addressing right now. And those examples could be that you've been in a traumatic car accident. It could be that you've suffered a stroke. It could be that you've had a myocardial infarction. Any of these events where you are triaged to the top of the list and you need to be seen right away. We're very good at addressing those issues. And as a matter of fact, if you do have one of those issues, you're not going to experience the long wait lists that we hear about in the system. You're going to get care right away. And in an environment where we are triaging in that way, that makes a lot of sense. That said, we have underfunded those areas of medicine that stop those events from escalating and becoming acute. And so to take a system level approach to this and look at how do you stop the number of acute events that are going to be escalated? How do we intervene as a population, as a community, to ensure that we are being more preventative in our approach? And the way to do that is to look at the long course of somebody's life, and how do you prevent somebody from becoming ill or developing disease or comorbidities that are going to ultimately lead to acute escalation. That's investment in primary care. That's not only investment in our general primary care infrastructure and the people that support that, but it's also resourcing preventative tools that are much more cost effective to deploy. And that includes remote monitoring technologies. So how can you limit the number of interactions that someone needs to have in an office with a physician or another care professional, the most expensive type of interaction that we have? And how do we leverage resources to ensure that healthcare is viewed as that entire spectrum where you're supporting people mostly in their homes to be well every day? So that's where there's a big opportunity to look at shifting that focus and investing in that area so that you are ultimately offloading the system, but it's not something that happens overnight.
Yeah. And on that, one of the quotes that you had in the paper, and it caught my attention, was this, and I'll just read it. If our primary and preventative care strategy does not deeply consider the role of social determinants of health in the quality of care we deliver and the outcomes we strive for, we have lost. The "we have lost" really struck me. So why are social determinants of health so imperative in driving the investment in the quality of our healthcare?
So social determinants of health, I think, are often very overlooked as drivers of health outcomes. And if you look at what those determinants are, you can see how they're very, very tightly linked to how well somebody is. If you can't access appropriate food and nutrition, if you do not have stable housing, if you are unable to care for yourself, your health is going to be impacted. And there generally speaking hasn't been, I think, enough emphasis or work that has gone into quantifying how critical it is that those social determinants are identified, tracked, and addressed, because ultimately somebody's wellness is inextricably linked to those things. Where there's a big, big opportunity with remote care and telemedicine is that we have this ability and this conduit where, whether it's via devices or ongoing communication with an individual, supporting them in their day-to-day, we can track those items and we can track them and we can potentially intervene. And it's not something that needs to be done in the context of a very narrow intermittent visit with a doctor. It's something that we can do a better job of methodically quantifying, tracking, and addressing all the time. So I think it is heavily overlooked, and it's something that's been really evident to us with Orpyx as a company. And I'll explain why that is. Because when we deploy our technology, we're deploying insoles, the peripheral devices required to support those insoles, and then it's as part of a turnkey solution with remote monitoring services with credentialed nursing staff. and before we actually implemented the remote monitoring services with nurses, we used to dispense the device in isolation. So if a patient was prescribed the technology, they would then really literally be left to their own devices with that technology. What we found is that we got very low adherence. We saw use dwindle over time. We saw just generally low levels of engagement from patients. And then we had no indication as to why that was. So there was no ongoing communication to identify what was driving that low level of adherence. As soon as we started implementing remote monitoring, we now have this ongoing dialogue with an individual to understand the complexities of what works for them, what doesn't work for them, the challenges they're experiencing in their day-to-day life that are limiting them from being the healthiest that they can be, and that are us not understanding that limits us from being able to help that. So as soon as we created this turnkey solution, we had the ability to communicate a conduit for information and a way to understand the lived experience of that individual every day in a way that we can now address with our offering. So that's allowed us to really understand that piece. And as we've been more conscious about social determinants of health and how they impact engagement in a system like this, we've been able to completely change the level of engagement of individuals in our program. Like it's like night and day. So it really has shone a light on those opportunities in healthcare for us based on our own direct experience. And I'm very passionate about how we can leverage that experience into just healthcare on the broader scale, and how we can leverage remote care services to support primary care as it exists today, and just be much more preventative and better at delivering care.
Yeah. And we'll talk about a few of those strategies later on. But you also outline this very nice vision for healthcare in Alberta. You talk about the quote unquote Alberta advantage and how that drove a lot of success for our oil and gas sector, but also how we can apply all of the characteristics of entrepreneurialism and innovation and, perseverance and risk taking to transform healthcare. Can you expand on that vision a little bit?
Yeah, absolutely. I think I love having our company situated in Alberta. I think that those qualities that allowed us to excel and become a world leader in the oil and gas space are very transferable to other areas of innovation. And I get so tired of being typecasted as a province, as an oil and gas province, because what we are is we are a province full of people who are entrepreneurial, who are gritty, who really want to excel and pathfind. It's really in our blood. And I love that about Alberta. I love that about the people that we employ at Orpyx every day, is that we're pathfinders. And we can pathfind through any industry. This is not something that is specific to one sector or another. And many of the people that we employ, for example, have come from oil and gas in some way, shape, or form. And that grittiness and that excitement about carving out new territory is something that transfers throughout, whether it's healthcare or what have you. So I think we can take the fact that we have been able to do that before and really leverage that for new things. And so, I just think there's nothing that we can't do if we think of ourselves in that way.
Yeah. The other phrase that's coming to my mind is can do. We're a can do province. We can do it. And, I totally agree with you there. The Alberta advantage in some ways is a bit of a mindset. It has all these characteristics that we can apply to virtually any industry, because at the bed, the bedrock of it is that innovation. It is that can do spirit. It is that entrepreneurialism. And I love this concept of pathfinders. And, you have about 4 well, strategies or like paths, if you will, in this report. And you did talk a lot about remote monitoring technologies and telemedicine services. Can you talk a little bit more about some of the other ways that we can really start the path to achieving this vision?
For sure. I think so. First and foremost is there's a concept of promoting team-based care. So when we think about what is the team, that team is not only the traditional healthcare team that is supporting patients within visits that they have at a doctor's office or an emergency room or an urgent care clinic or a specialty office. It's about integrating all of that with best in practices remote care. That's the team. So making sure that we can do whatever we can to leverage communication and technologies to support a multidisciplinary approach that's considerate of an entire patient's journey and all of the ways that they interact with the healthcare system, and ultimately all of the very interconnected ways that they interact with the healthcare system. So that's one thing, out of the gates, is how do we support that in the best way possible? There can be different ways to actually financially support different models. And without getting into detail about them here, I think oftentimes what makes a lot of sense is, rather than supporting models that are based on fee for service, so I do this one thing, I get paid this amount, you start creating multidisciplinary payment models that are based on the success of managing that patient. So it's outcomes based. And it's ultimately linked to what value is being delivered to that individual and to the system at large. So that's not something that happens overnight, but I think consideration of new models and that support shared decision making, shared responsibility for patients, and shared responsibility over outcomes. I think that's really key. Mm-hmm. The other thing is, and this is related to the team that's supporting patients, the healthcare team at large, really doing whatever we can to prioritize bringing in the best and most sufficient volume of primary care talent that we need in the province. We are under-resourced from the perspective of primary care in Alberta. There are not enough clinicians to support the population right now, and the distribution of those clinicians isn't as effective as it needs to be. So really taking approaches to address the shortage of family doctors, ensuring that we are incentivizing movement of those clinicians into the province, making it a very attractive place to practice, and then also incentivizing movement of clinicians to the places that they need to be to best support patients. If, again, back to the remote care, the more that we leverage the remote care, the less requirement there is going to be to have more family physicians as distributed as widely as possible. So while it is required to have the distribution, you can support a lot with remote care services in between. And then I think from there, it really comes down to leveraging preventative and remote care technologies and embracing bringing in new technology. So whether it be remote care or other technologies, always looking towards the best way of delivering care. And what that means is we as a province need to think about, how do we support an innovation pipeline into our system? We have very excellent companies growing within the province of Alberta that are developing innovations that have never been done before. So new technologies, some good examples would include Sciantra. So they've got an AI-driven breast cancer tool. Nanotest is a company that has created catalytic wound dressings that is showing very promising early results. Circle Cardiovascular has been a great example of an Alberta-grown success in medical imaging. How do we harness what we're already supporting and building within our community and start to see some of that add value back to our own healthcare system, making sure that we have the clearest pipeline of innovation to really deploy those technologies as quickly and swiftly as possible within our own province is important. in many situations in the past, we see these technologies be built within Alberta, and then they're primarily supporting communities south of the border. How do we make that not happen? How do we make sure that as a community, we're able to see the benefits of what has been created on Alberta soil?
Mm-hmm. And that's certainly one of the, core challenges that I've heard in talking to other health entrepreneurs, that just we have a hard time buying local, adopting the technologies that are created here. And it doesn't exactly create that culture of innovation, nor does it really create incentive to continue to be in Alberta. So, what are some of the other challenges that you're seeing to really build this world-class healthcare system in Alberta as you see it, and then also kind of the follow-on benefit being creating improved outcomes and economic opportunities along the way?
I would still say that the biggest challenge is related to the clarity of that pipeline for companies getting their product considered for piloting or longer-term purchasing within the province. There are so many things that we have going for us right now in Alberta and in Canada in terms of the programs that exist to support research and development. There are several tax incentive programs and grant funding programs that have been reasons that very prominent investors in the US are investing in Alberta and Canadian companies, is because they make development very attractive. Mm-hmm. So we have a huge advantage in doing R&D here from the point of developing, where you've had that support, you've got lots of programming that's supporting that development. How do you then encourage and support the commercialization and the purchasing of what has been created? Like, that is the biggest gap. And there are significant strides being made in this. There has been within Alberta Health, there is a group called the Alberta Health Research and Innovation Group that is actually very much focused on developing an innovation pipeline. The biggest problem is that I don't think everyone knows about it yet, and I don't think all of the eyes and attention are on it. And that group needs to get they need to get all of the support from Alberta Health and Alberta Health Services more broadly to understand what they're doing, and for every single person within our health delivery organizations to understand that we do innovation, we innovate, we take in new technologies, we provide the best technologies there are, whether they're Alberta based or coming from other provinces or countries, and we bring them in and we innovate. That is what we do. And I don't think at this point that culture of innovation is something that has been communicated, embraced widely within our system. But the people are innovative, and I think that culture of innovation needs to be set and communicated and reiterated and embraced with programming on an ongoing basis. So strides are being made in this way, absolutely. We just need to really highlight what we're doing and make it very clear for any company that wants to do business from a health tech standpoint in the province to know exactly where to go to. And once they're at that point, that the intake process, know exactly what steps that they need to take to be considered for commercialization within the province. It just needs to be a very clear, defined pipeline that gives answers quickly. Mm-hmm. We're getting there. We're not there yet.
What other, I guess I'll call them key needle movers, do you think the province or even the country should consider for this to become a reality?
I think the biggest thing is examples. So the second you have a handful of success stories, and this is like, it starts with one success story that's been able to do this very effectively within the province, there is such a pull for more at that point. So the more examples for success that we create, it's going to beget more success. It's going to beget more influx of innovation into our system and our community. And so I think that's the key, is focusing on one, then two, then three, and it grows from there.
So social proof. If you could move forward just one idea, investment program, or moonshot to make this vision a reality, what would it be?
So I have a very biased view on this, just given the area that I'm working in, but I do think it's very founded. And that's that we do need to shift more of our longer term focus on some more supporting remote care. So how do you prioritize more care to be delivered in the community? The only most cost-effective way to do that for the long term is to embrace care as being remote. So what are the technologies and services that will allow for that to happen? So you're decreasing the number of visits, acute or non-acute, to physical institutions. The more that we can understand the levers to the success of somebody's own health outcomes and how they are driven by what happens every single day in the patient's house, if we can understand that and we can support patients on an ongoing basis and have a window into health and wellness, then we will succeed. So I think a big shift towards prioritizing and encouraging preventative remote services is going to be a big lever in the success of our health system over the long term.
Well, I think that's a very optimistic note to leave this conversation. Well, thank you so much, Dr. Everett, for joining this series of Missions and Moonshots.
Thank you for having me, and thank you for the opportunity to contribute.
Well, thank you for tuning into this special episode of The Brief. And you can read Dr. Everett's paper in its entirety at definethedecade.com. And we will be releasing new episodes in this series periodically. So make sure that you are subscribed to Alberta Better on Apple Podcasts, Spotify, or wherever else you get your podcasts to be the first to access new episodes. Thanks for listening, and we will see you next time.